rendah hati berdiri di sini untuk membentangkan Belanjawan 2020.
Assalamualaikum. My name is Nur Aliyah Nabihah binti Nazamira. I am the moderator for today's discussion. So, let's start our discussion for today.
I am Nur Fatih Adiba binti Wandi and I will be the first panel.
I'm Nick Nur Farahani binti Nasruddin as the second panel for today.
I am Nur Iman Atira binti Muhammad Asri and I am the third panel.
I'm Nuzafira Auni binti Muhammad Samri. I will be the fourth panel.
First of all, I would like to thank all the full panels from Ministry of Health because joined the discussion for today. I have been informed that our discussion will be discussed about public budget in Malaysia with the Ministry of Health. I also be informed that the budget are based on the budget 2020. Firstly, can any panels explain to me about on what actually the public budget and also what is your understanding about it?
Thank you, moderator, for asking me. Based on my understanding, the actual meaning of public budgeting is a method of calculating and translating plans for the use of real resources into financial value. Public budgeting also requires a strategy that forecasts a state's expenses and revenues over the next or future financial year, usually 1 year period. There are two categories of public budgeting, which are public expenditure and public revenue. Public expenditure divided by two, which are development and operational expenditure. So, for this discussion, we want to propose three projects, which are Project 1, Supply Ventilator Machine Program in Sabah and Selangor, Project 2, Mobile Hospital in Sabah, and the last project, MindSense Program.
Okay, thank you first panel for your explanation. Next, I would like to invite another panel to explain more in details regarding on the project 1 that you want to propose to Ministry of Health.
Thank you, moderator, for the question. So, for the further detail regarding our project 1, for the project title for program 1 is Supply Ventilator Machine Program for the main hospital in Sabah and Selangor. So regarding on the issue for the implementation of this program is due to the high mortality rate that causes due to the unavailability of ventilator machine in intensive care unit ICU at the main hospital at Sabah and Selangor. So as we all know, ventilation is crucial in preventing the virus of COVID-19 from spreading. So based on the statistics shown, the number of cases in intensive care unit ICU is grow such a rapid pace. Therefore, hospitals all around the globe are trying so hard, especially Malaysia, in order to equip with more ventilator machines as the number of patients in ICU are increasing. According to data, Dr. Nur Hisham Abdullah said that on 7 September review, the total cases with 9,385 cases and 128 deaths respectively. So basically, ages becomes the most crucial factor contributed due to the coronavirus kill. Here result, the statistics show the mortality rate were at 2% for the ages of 18 until 40 years old, 14% for the ages 41 years old until 60 years old, and 84% for patients above 60 years old. So, from here, we can see most COVID-19 cases are affected by the person over the age of 65 years old. This year, we could assume that without ventilator machine, person who have tendency to survive will automatically die. This year, I, as the representative officer from the Ministry of Health Malaysia, want to propose this first program that joint venture between the Ministry of Health and also NGO. That's why we need to allocate more operational budget to get the 400 unit of ventilator machine to be supplied at the main hospital in Sabah and Selangor. With both hospitals will receive 200 unit of ventilator machine for each of their ICU unit.
Okay, may I know more about the objective of this project?
Thank you, moderator, for the question. So regarding on the objective of this project is the first one, first of all, it will lessen the amount of mortality rate death cases to pandemic COVID-19. Secondly, we will supply more ventilator machines in order to tackle the problem of shortage respiratory aids at the hospital. Together, we tackle the issue not only focusing on the COVID-19 cases only, but also focusing on the cases other than COVID-19 like other infection disease. Besides, the other objective, it also could lessen the number of patients in intensive care unit ICU so that doctors can put more focus on the urgent cases. And lastly, to increase the level of recovered cases by supplying enough ventilator machine. So, that's all for me. I will ask YB Iman to brief in more detail regarding on this project one.
Okay,
Thank you,
sure.
Warbini.
You may proceed.
Operator, thank you, Warbini. So I will continue to explain the expected results for Project 1. So with adequate ventilators supplied to the main hospital in Sabah and Selangor, doctors does not have to make life or death decision about who needs ventilator machine the most. As all knows, hospitals around the world, including hospitals in Malaysia, are facing a shortage of ventilators. Despite ventilators are crucial and act as weapon to fight with COVID-19, especially to the help patients who in critical condition and struggle to breathe by themselves. Therefore, by secure 200 more ventilators to each 2 hospitals, it will help the patient to get life support equally. Next, with enough number of ventilators, patients do not have to go for far hospital just to get the full treatment. First of all, we have to bear in our mind that not the COVID-19 patients only need the ventilator machines, but it is also used for the patients who is during surgery, coma, stroke, and many more. Not just on that, the machine also become the most demanded by COVID-19 infected patients who in critical condition. Therefore, by secure more ventilators, it could be lifesaver for patients and they don't have to wait for too long or transfer to another hospital just to get ventilator treatment. This indirectly will lower the cost of hospital vehicles, which is ambulance, to transfer the patients to another hospital.
From your research, do ventilator can reduce the mortality rate in Malaysia?
Thank you, moderator, for asking. Yes, by secure more ventilators, it will reduce mortality rate in hospitals. Although it won't cure the illness, but it can keep the patients to fight the infection by delivering oxygen to patients who can't breathe by their own. And ventilators become the very important tool in battling the novel coronavirus. Lastly, it can reduce the cases being treated and increasing cases recovering. So the mechanical ventilation is necessary for patients who diagnose severe level in hospitals ICU. Ventilators will help to support those patients to breathe until their immune system and their lung can properly function. Hence, without this machine, the tendency of fatalities rate may increase day by day. For now, that's all from me. Thank you.
I wonder where the exact location for this program?
Thank you, moderator, for the good question. So regarding on the location for this program, we will propose at 2 different locations, which is first one at Hospital Queen Elizabeth Sabah and the second one at Hospital Sungai Buloh at Selangor.
Okay, why do you choose these 2 locations?
Actually, this is the early stage focus by Ministry of Health Malaysia to supply ventilator machine at these 2 main hospitals in Sabah and Selangor. This is because, as we all know, the Sabah and Selangor recorded the highest number of cases, as well as the number of patients in their intensive care unit ICU also keeps on increasing. So next, I will further details explanation about the implementing agency. So regarding on the implementing agency for this project, one is Ministry of Health itself. The second one is National Disaster Management Agency, NADMA. The third one, implementing agency, we have NGO under Mercy and also Etika. Transport Ministry under Malaysia Airlines in order to brought the ventilator machines to our country. And the last one, implementing agency for this project one is Pharma Niaga Berhad. as the biggest pharmaceutical supply for medicine for the Ministry of Health Malaysia. So that's all from me.
Okay, I can see your clear plan about this project. So how about your proposed duration?
Okay, so I will explain about the proposed duration. Thank you, moderator. So for the proposed duration, for this project, it will take up to 3 months, starts from 10th November 2020 to 10th January 2021. The allocation requested for operational budget is 100 million. And based on our observation and calculation, we will spend for about 54,538,000 for cost analysis.
Can this project give the benefit to the government? May I know?
Yes, government will get benefit for about 120,573,000 and 550 ringgit benefits within 12 months. The payback time is 0.5 of a year. That's all from me.
Thank you, YB Nick and YB Iman, on the detailed explanation about your project Wine. So, now I am really curious to know what is the next project for the Ministry of Health want to propose. Can anyone proceed?
Thank you, moderator. I would like to proceed for the details of the second project. The second project is Mobile Hospital Project in Sabah, which will be focused to the rural areas and islands. Mobile hospital is a medical center or a small hospital that can be moved and consists with full medical equipment. This project is focused on the COVID-19 issues and proposed due to some issues regarding the assessment of COVID-19 cases in Sabah. This assessment is due to several reasons, which one of them is because of the Pilihan Raya Negeri Sabah (PRN) in 26 September 2020. It is due to the politicians that held campaigns which joined by too many people and they are clearly not following the standard of procedure (SOP) accordingly, such as social distancing. Besides, this project also is proposed due to the lack of information and awareness among the people in Sabah about COVID-19 than people in West Malaysia. As we know, some of them ran away after they saw a group of our health workers entering the village area, as well as they do not really know what is SOP means. Furthermore, mobile hospitals project also will be implemented in Sabah, as those in rural areas and islands are difficult to get treatment and swab tests as they are far away from town. Therefore, they cannot easily access to hospitals facilities, as it was already proven by the residents of Sungai Mujuk, which they have to ride a boat for 4 to 5 hours to arrive at town. Next, they need to go through for 120 kilometers, as well as spending for about 700 ringgit and above to the hospital treatment. On 18 October 2020, a person with COVID-19 have to wait for several days to be warded at the hospital because the hospital is not having enough beds. Moreover, the patient also need to wait for a few days to get their result of swab tests. Hence, COVID-19 cases will be increased and mobile hospital project is to prevent COVID-19 from spreading among the people in Sabah. That's all from me.
So panel, can you explain me about the objective of this program?
Okay, moderator, moving on to the objective.
Alright.
The first one is regarding to the issue. It is to flatten the curve of COVID-19 cases in Sabah. The result is to be expected that the cases in Sabah will decrease and as mobile hospital will provide proper treatment to the patients and in a short time. They will be quarantined immediately in mobile hospital as well as observed by the staff. Second objective is to assist the COVID-19 patient from rural areas and islands in Sabah to get early treatments. We expect that this project will prevent the people to take a long journey to get treatments in hospital as what I have issued. It is also to increase the well-being as they will be served their basic services during this pandemic. They also can save their money as they do not have to spend more for them. For the next detail, I would like to pass to YB Adiba. Can I proceed with her, moderator?
Okay, sure, you may proceed.
So I will proceed to explain more about the objective of mobile hospital is to give awareness to the people from rural area and island in Sabah about COVID-19. The implementation of mobile hospital can increase the level of knowledgement and information about COVID-19 among them. Is because patient will be provided some information about COVID-19 during quarantine session and swab test. The health staff will share about the importance to complying the standard operation procedure and the dangers of COVID-19. The advice are given because they lack information about COVID-19 and there are some of the residents escaped when they saw the health staff. Those mobile hospital very important to give awareness about COVID-19 to rural and island people in Sabah. Furthermore, the project of mobile hospital also want to detect the early stage of COVID-19 symptom among the people in the area. The staff of mobile hospital will detect those with early symptoms like coughing, fever, and sore throat. The patient that have this symptom will warded quickly before they become worse and result to this. Hence, mobile hospital will prevent the number of this because of COVID-19. That's all for the objective and expected result for this project.
So, can you let me know the list of the implement agency that will be involved in this project?
For this project, the agency that involved is the Ministry of Transportation, which is they will provide the caravan and other transportation, while the UMW Corporation Sdn Bhd will fully participate in managing the mobile hospital in terms of giving a service to patient. Lastly, Medical Relief Society or MERCY will contribute the equipment of treatment for mobile hospital. The location for mobile hospital is in rural area and island. For example, Tawau, Ranau, Gaya Island, and others.
May I know why do you decide to pick this location? Can you explain about it?
We decided to implement the mobile hospital in this area because most of the people difficult to get proper treatment. Those mobile hospital will make them be easier to get treatment, especially in this pandemic. Other than that, the people that live in this area lack of knowledge about the current issue and about COVID-19. Those mobile hospital can give awareness to them through the service that will provided. The proposed duration that will take up for this project for 4 months, which is starting from 20 October 2020 until 20 February 2021. This project not take a long time to implement because we must take fast action to prevent this COVID-19 in Sabah.
Can I know how much the allocation request by this project?
The allocation budget for this project will spend 100 million with using the development budget. For the cost analysis, we need around 55.9 million, while the benefit analysis that will gain around 69.68 million, the payback time 0.8 of a year or approximately 9.6 months. Thank you. That's all for explanation of Project 2.
Alright. So, I think it would be great if I could hear the explanation in detail regarding to Project 3. Can anyone from the panel could proceed then?
Sure, Ken. Thank you, moderator, for the good question. So regarding on the Project 3, we want to introduce the project title, which is My Science Program, where this program actually in order to provide the training session for the professional psychiatrists in Malaysia. Thus, this program comes with the 3 main different issues to be settled, which is the first issue is in terms of the lack of the numbers of the professional psychiatrists in Malaysia. So, Malaysia experienced a significant journey in delivering of care to its citizens in the mental health service. Based on statistics, there are 32.4 million population in 13 states. However, there are only 410 certified professional psychiatrists in Malaysia, with a population ratio of 1.27 over 100,000. According to World Health Organization WHO, it shows Malaysia still lacks 3,000 psychiatrists to achieve the minimal ratio set out by them. Thus, here it shows that our country is still lacking in terms of the number of professional psychiatrists in Malaysia. Next, regarding on the second issue, It is because of the increasement of the mental health illness issues among Malaysian people. Mental illness is becoming the emerging issue in the country, and the corrective action must be taken immediately to settle this problem. The number of mental health problem cases increased from 6,051 in 2014 to 6,125 in 2015, and it continued rising until today. However, this problem became more serious in 2020, where our country expected to become the second biggest issue of the mental illness after the heart disease.
Can you specify me what is the common health issues affected by the Malaysian citizen?
Sure, I can. Thank you, moderator, for the question. So, the common health issue among the Malaysian are depression. As more people assume to have a depression, as they experience increase in stress with the workload and also the family pressure. In fact, here I want to stress there are around 500,000 Malaysian people who suffered by this mental illness issue, as the number of suicide cases are keeps on increasing, reported by the Ministry of Health Malaysia are at 465 cases occurred in this year, 2020. Therefore, the government needs to allocate more funding to Ministry of Health to implement the best mental health solution to combat this issue immediately. Thank you. So, I will pass to YB Adiba to brief in detail regarding the Project 3 objective. May YB Adiba proceed with it, moderator?
Yes, you may. Can proceed.
Thank you, moderator. First and foremost, the objective of my SEM program is to reduce the amount of mental health patients in Malaysia. Is this because mental illness is the second highest health problem in our country by 2020. A lot of people are losing their jobs and income, especially on the first movement control order, starting on 18 March 2020. This situation is quite stressful and affect their mental health. Therefore, this program is proposed to bear more people with a healthy mind. In addition, the objective of this program is public will help the proper channel to propose their problem by seeking consultation session with the psychiatrist. It's because through my SEM program, we will provide a better service and treatment to combat the mental illness. The psychiatrist will be trained by the specialist psychiatrist in terms of how to detect what kind of mental illness there are, how to be a good counselor for giving back their strength, how to manage with the mental illness patient and others. This program will give a lot of benefits so that the psychiatrist be able to deal with this issue. Thank you. That's all from me. To explain more, I will be passed to YB Iman.
Thank you, YB Diba. I will continue for the next objective. Next objective for my SENSE program is to increase the number of professional psychiatrists in Malaysia. It is stated that Malaysia only has 204 psychiatrists working in government facilities. Therefore, Ministry of Health seeks to hire additional contract psychologists to tackle down towards coronavirus-related mental conditions. So through this program, psychiatrists will be given enough training in treating mental illness and help the government to cope with shortage of professional psychologists and psychiatrists. Next, the objectives are also to help those who are not mentally stable, especially people who are affected by this pandemic, in order to build back their spirit and to combat suicide cases among Malaysian people. It is because mental illness can lead someone commit crime, such as murder. Actually, these people is suffering with mental problems and they cannot stabilize their mind. Therefore, my SENSE program is one of the efforts to handle this issue in our country by providing more professional psychiatrists. That's all from me. Thank you.
So, which are agencies that's involved in this project? May I know?
Thank you, moderator, for asking. The implementing agencies are involved the Mental Illness Awareness and Support Association, MIASA, the Psychiatrist Departments of University of Putra Malaysia Teaching Hospital, and also Mental Health Innovation Network Malaysia, Mentari. these agencies, Miasa and Mentari, will allocate 5,000 ringgit each.
Okay, may I also know what is the amount of allocation of the budget that had been proposed by this project?
We propose for 1 million ringgit from the operational budget and expected to get 11,023,405 ringgit, which the payback time is about 5.5 months. In addition, the duration of this project is expected to take up to one week from 9 July 2020 to 13 July 2020. For the location of this project, I would like to pass to YB Nick to give the details.
Thank you, YB Auni, for asking. So basically for the location for this My Sense program, we want to implement this program at Hospital Kuala Lumpur, Malaysia.
Why do you pick that hospital? As we know, there are a lot of hospital in Malaysia. Why the main focus at the KL hospital, Kuala Lumpur hospital?
Thank you for such good question, moderator. So actually why we propose allocation to Hospital Kuala Lumpur, it is because as we all know, Hospital Kuala Lumpur is the national hospital for our country, Malaysia. And for sure, it has a lot of facilities to be used during this training session. So I think we are already at the end of this today discussion. So I would like to conclude everything about this today discussion. So that's all of our proposed project and program for the budget 2020. And I'm YB Nick Nofarhani binti Nasharuddin as the representative for all the 4 panels for today's meeting. Hope that that these 3 projects can be approved and implemented as soon as possible as to the best of the future. Thank you. That's all from us.
Okay, thank you for all the cooperation and contribution of all the 4 panels. I hope that the project that had been proposed can be proceeded later on. Alright.